Hi YouTube, this is Mary. This is the third video I've made this morning. The first one was too long, and the second one, my computer crashed in the middle of it. My computer is aging, and I have been talking recently that I need to start backing up everything on it because it has been crashing periodically, and I don't want to lose everything that I have on there. Photos mostly. I don't want to lose my photos. But I'm not quite able to replace it yet, so it's going to have to limp along until I can afford to replace it. Today, I don't know the date today. Today is Wednesday, I do know that. And 1 week ago today, I had my gastric bypass RNY surgery. I was in the hospital until Friday, and one day longer than I thought I would be. The doctor told me 2 days, and on Thursday when he said, well, I think you can go home tomorrow, I said, well, I thought I'd be home today. And he said, why would you think that? And I said, well, you told me 2 days. And he said, well, we don't count the day of surgery. So I didn't know that. And frankly, I'm kind of glad I had the extra day. It was nice to have someone helping you out with the things that were difficult post-surgery. Even though it's 1 week, I still can't say that I'm feeling chipper or skipper. I'm still taking my liquid Lortab, although I just decided to drop it down to half a dose today. I have just one spot that just doesn't seem to want to improve. It's right on the, right left side, just below the rib cage, about hand size. I'm assuming that below it is where the majority of the work was done, because it just is tender and not recovering as well as I had hoped. It still makes me get up carefully, makes me walk a little bit like an old lady. And yesterday I was anxious enough that, I felt it. It felt kind of hard underneath. And all of a sudden I started thinking, oh, what if I've got a leak? Because the hospital, for some odd reason, never did the upper GI they said they were going to do. I was supposed to have it Thursday afternoon, and Thursday afternoon went past without them sending me. And I just thought, well, I guess I'll do it Friday before I go home. And Friday, I just never thought about it, so I didn't ask about it. And it wasn't until I started having this pain right here that suddenly I'm thinking, oh, what if I have a leak? If they should do the upper GI just to give you satisfaction of knowing there's not one, if no other reason. Because the first thing I did then is go online to research leaks and scared the bejesus out of myself as I'm reading about people dying from leaks from their bypass surgery. But I'm feeling a little better today, and I think one of the reasons I'm feeling better is not last night, because that would be Tuesday. Monday night, as I was taking the antibiotic the doctor sent home with me because one of the incision sites looked a little red, I noticed it said take 4 times a day. Well, I know that I read the bottle the first day, and I must have read 4 times a day, but in my head I've been taking it twice a day. So I've only been doing half the antibiotics that I should have. And yesterday I bumped it up to the 4, and today I seem to be feeling a little better. So it could be the prolonged discomfort is an infection just below the surface that will heal up faster now that I'm taking the correct dosage of antibiotics. I did send an email to my doctor, but he hasn't responded yet. I don't know what is the point of having this online My Healthcare service if they don't respond to the emails you send them through it. I didn't think that the surgeon would so much, but I thought somebody from his office would. It's neither here nor there. So I'm not feeling chipper skipper, and I thought that by now I would be. I usually recover pretty quickly, and so many people I had talked about how much better they felt by now. But in retrospect, I haven't been taking my antibiotic as directed, and I'm probably making an error when I try to compare the recovery timeline of a 59-year-old, and a 39-year-old. So I've decided to just relax and tell myself that I'm getting better and not to fret about it. What else can I say? I came home with an on-Q pump still, attached. And they said that when it was depleted, I should just pull it out. In fact, the nurse said, "Oh, it comes out slick as snot." I remember saying that because I thought it was such a funny thing to say. And frankly, I didn't want to be pulling out, no matter how slick it was going to be. She said it might be a tug a bit at first because of a bit of dried blood around the tube, but it should loosen up and pull out just like that. Well, I was lucky because my son and my brand new daughter-in-law were up for the weekend. She is a nurse, and her previous job, she just started a new job like 6 months ago. Until then, she was working in a post-bariatric unit at a hospital in Minneapolis. So I just said, "Amanda, please, will you take out the on-Q pump?" And she was happy to do that for me. And it was not slick as snot. She was pulling pretty hard at it. In fact, I said, "Amanda, is this slick as snot?" And she said, "No, it's kind of hard." She said, "They must have it curled up inside." Then she said, "I can't believe they're making you pull this out. We always remove them from our patients before they go home." So I didn't have to take it out. Yay! I started taking my chewable vitamins. The doctor wants me to take 4 bariatric chewable vitamins a day. I bought Fusion. I think I showed these once before. This one is the orange cream flavor, and it's really pretty tasty. I don't have to be up to the 4 a day, but they want me up to the 4 a day by the 2 weeks. So by next Wednesday. In addition to that, I have to take one Viactive with all that light from my shades. You can't see it. Let's see how I can get it in there. There we go. Viactive calcium a day. And they said not to take the bariatric ones because the Viactive has vitamin D in it, and they want the increased vitamin D. And on top of that, I also take a vitamin D supplement. So 4 vitamins, 1 Viactive, and a vitamin D supplement per day. So that's not too bad. It's just going to be getting in the habit of getting those 4 in a day, especially when I can't even get my antibiotics in, apparently. Other than that, I'm doing good. Still on liquid diet. I'll be on liquid diet until I see the post-surgical care nurse and the nutritionist next Wednesday, and they give me the thumbs up to move on to the next stage. In fact, they don't even tell you what the next stage is. I mean, I know basically what it is, but they don't even send the information home with you. You have to go to the appointment and get it. So I'm doing okay. I'm not doing great, but I'm doing okay. And maybe okay is great. Maybe my expectations are too high. I weighed myself before I went in for the surgery. I weighed 243.7. When I came home from the hospital, I wrote down here, 251.8. So I'd gained 8 pounds in the hospital. And this morning I was 244.3. So I'm still not back to my pre-surgery weight. So I still have lots of that water weight. Hanging around, and the sooner it goes, the happier I'll feel. It'd be nice to at least weigh as much as I did when I went into the hospital. So I'll update you in a week, let you know how I'm doing. I expect I'll be doing much better. I'll wait till after my visits before I update because that way, if there's anything that they say at the visits that's worth passing on, I will do that. Until then, for those of you who sent me a message wishing me well, thanks so much. And it feels good to be back. I'll see you next week. Bye.